This is Li Zheng, licensed acupuncturist and herbalist. Today, I'd like to talk about obsessive compulsive disorder. It's also called OCD. When people are diagnosed as OCD, they tend to be compelled to do certain activities repetitively. For instance, they like to wash hands many times whenever they touch things, and they have such strong feeling towards something. It's called obsession. And for the OCD, there are different types. There are rumination, hand washing, and intrusive thoughts, contamination, and checking the doors and to make sure it's safe. So this all related with anxiety, because when you're worried about things, you just repetitively to check. When the nerves are not balanced, you tend to overthinking things, and so that's why they use medication. Doctor use medication, antidepressant, anti-anxiety medication to ease the symptoms. But with the medication, there are other side effects. For instance, SSRI can make people gain weight, and also they can sleep the change the pattern. People wake up feel groggy and sluggish and no motivation. So in order to reduce the side effect of the medication, but still can control the OCD symptoms, so people with these problems can cope with the daily life and still focus on the things they need to be focused. So combining acupuncture with medication and behavior treatment, we actually can achieve the best result and also reduce the side effect. So how acupuncture can help with this OCD and the anxiety related with the OCD? First, acupuncture can balance the nervous system. So whenever you had an acupuncture treatment, you feel so relaxed and you don't worry about things, you don't think about things too much. That's how the relaxing part of the nervous system gets strengthened. So the heart rate slow down and your brain are rewired. So the relaxing center of the brain are activated. The hyperactive part of the brain can be calmed down. The other thing acupuncture can help with OCD is it helps the body producing more relaxing hormones such as GABA, serotonin, dopamine. It's not let the body produce one single hormones too much. It's orchestrate the different kind of hormones, neurotransmitters, so the nerves can function at an optimal level. And acupuncture can also make you sleep deeper and digest better. And that's two factors can help your body and mind be balanced, be coordinated in a balanced state. So there is a research showing that acupuncture combining behavior treatment and medication help people to control the OCD. In Journal of Psychiatric Research 2016, Dr. Feng with other colleagues did a research. They recruited 360 people and they divided them into 3 groups, and they carried out a randomized control trial. So group A, they combined 3 treatments, electrical acupuncture, medication, and behavioral therapy. And the B group, the second group, they get rid of the medication, just using acupuncture and behavioral treatment. And the third group, they will use sham or simulated acupuncture with the behavior treatment. And the finding is, combining 3 treatments, they have effective rate of 88.3, while if you get rid of the medication, the effective rate only drop a little bit from 88.3 to 81.7. So there's not big differences between A group and the B group, meaning the medication does not make too much differences. On the other hand, without medication, patients have less side effect. Then let's look at the third group. When they use sham acupuncture, not a real acupuncture, combining with medication and behavior, the effective rate dropped to 67%. So that's a big drop comparing 88 and 81. That means acupuncture really played an important role to reduce the symptoms. Moreover, they find when they use acupuncture, combining the medication, behavior, treatment, they have higher rates of remission, meaning that people will, the symptoms will not come back for longer time. So the remission rate for acupuncture, medication, behavior, combining these 3 is 30%. And for acupuncture and behavior therapy, the remission rate is 22.5. While if you get rid of acupuncture, only behavior and the medication, the remission rate is 9.2 after they finish 12-week treatment. So again, you'll see the differences between with medication, without. It's not a big difference. But get rid of electric acupuncture, the remission rate is dropping, meaning after the 12-week treatment, more people will get back symptoms in shorter time. So if people have severe OCD and couldn't function, then maybe initially combine medication, acupuncture, and behavior treatment. That will get higher effective rate, and then gradually taper down the medication and just stay on acupuncture and behavior treatment. That way we can reduce the side effect and also gradually increase the remission rate, and then people will get symptoms free for longer time with less side effect. So if you need more information about other conditions, you can go to BostonChineseAcupuncture.org. There are more information there if you type in keywords acupuncture and other symptoms. Thank you.